All right, guys, we are just 1 minute past the noon hour, Central Standard Time. Let's go ahead and get started. Good afternoon. My name is Mike Delaney, and I serve as the Senior Director of Business Partnerships with NHA Services. As many of you know, NHA Services, we are all about connecting our member hospitals. Got one more coming in. We're all about connecting our member hospitals with our preferred business partners. Our preferred business partners look for ways to increase efficiencies, lower cost, and essentially erase headaches for our member hospitals. And certainly our preferred partner, ClaraPrice, checks those boxes. Here in just a moment, I'm going to introduce Jory Hatton, who is the CEO with ClaraPrice. Just a few housekeeping items before we get started here. We do kindly ask that you mute your microphone just so we avoid sound pushback. I know after 2 years in the pandemic, we know we've all been accustomed to different webinars and team discussions. Secondly, we do encourage you to ask questions. We want this to be engaging and open dialogue. Jory's team is great, so please don't be shy. If you are not comfortable asking a question, please send a private message to me. You can either do that through Teams here or simply send me an email at mdelaney@nebraskahospitals.org. Without further ado, it is my pleasure to introduce Jory Hatton, again, CEO with ClaraPrice. Jory, we're excited to have you today, and please take it away. The floor is yours.
Thank you so much, Mike. I appreciate it. Can everyone hear me okay? Great.
I hear you loud and clear.
Perfect. All right. Happy to be here. Really appreciate the opportunity. Today, we're going to talk a little bit about payer price transparency and how hospitals should use that data, more specifically the payer transparency and coverage rule, and how your facility can leverage that information. Appreciate the introduction, Mike. So to start things off here, I kind of want to talk a little bit more about price transparency as a concept, just in general for both hospitals and payers, how they relate and how they're different. The price transparency requirements for hospitals are part of the CMS OPPS final rule for price transparency, which went into effect January 1st of 2021. And the price transparency requirements for the payers are part of the CMS transparency and coverage mandate, which went into effect July 1, 2022. Both facilities or organization types have specific price transparency requirements. There are similarities and differences. On paper, the requirements for hospitals are more in depth and spread across a wider variety of resources. But CMS has recently invested a lot of energy and effort into the requirements for the payer side of things, more specifically the required machine readable file. I'll talk about that here on the next slide. So the common denominator between the two, hospitals and payers, is that both have to post this comprehensive machine readable file. And it's a little bit hard to understand what a comprehensive machine readable file is, no matter what your background is. But really what that means is it's a file that machines can read or machines can parse or easily manipulate or read the data within that file. Again, the requirements for payers are much more specific and much more verbose, as CMS has recently invested into the transparency and coverage program with engineering and other knowledge-based subject matter expertise to create a standard set of requirements that makes a lot more sense in comparison to what is currently in place for hospitals. There's much more flexibility with the machine readable file for hospitals, but we see that likely is going to change in the future when reviewing the requirements for the payers. On the hospital side, we see a lot more consumer-friendly oriented requirements because these are things that patients are going to be looking at. Patients aren't necessarily meant to see view or interpret any of the data that's in that machine readable file, both for the hospital or the payer. But the consumer-friendly resources are meant to be used by patients or humans. So typically we're going to see requirements regarding a website of some kind or a widget that can be installed on a hospital website. There are two options for hospitals on the consumer-friendly side. They can generate a consumer-friendly list of shoppable services. That would be 300 shoppable services, 70 of which are predefined by CMS as part of the rule. So you have to post those no matter what, whether you offer them or not. If you don't offer them, you have to denote that they are not offered at the facility. But either way, you have to end up with 300 services. So typically you'd come up with an additional 230 services that you deemed as shoppable for your facility that you would post in that consumer-friendly shoppable service list. Another important aspect of this requirement is that it has to be without barriers. And there's an alternative path that you can take on the consumer-friendly side of things for hospitals by posting a patient cost estimator of sorts. But that patient cost estimator cannot contain barriers. And when I say barriers, I mean things like collecting information up front or requiring the patient to complete a form regarding demographic information or logging in or anything similar to that sort of process leading to actually getting the data that's required to be posted. So CMS is pretty explicit about restricting those barriers and making sure that those are not included in the resource. So again, the common denominator here between payers and hospitals is the comprehensive machine readable file. So with transparency and coverage, as I mentioned before, we're seeing a lot more innovation and interest associated with the machine readable file requirements. They've spent significant engineering time and collected significant subject matter expertise to put together a standards-based structure for this file, which we're rather surprised to see that wasn't necessarily the case with hospital price transparency in its infancy. But I think that it's safe to say that this is where hospital price transparency is headed as well. But the structure of this machine readable file is very specific. The way that machine readable files are typically structured and have to be structured for the payer side of things is going to be with a key value type of structure, and that would be essentially a name or a description associated with a value. So you can see on the slide here, we've got in the center, we've got an example here where we say name, report, charge code with a code, kind, CPT. Those are examples of key values. CMS has explicitly stated that the machine readable files for payers must be in a format known as, well, there's a few different options: JSON, XML, or YAML. Typically what we see is JSON. All of the documentation that CMS provides in their GitHub repository, which is a place where software information is stored and knowledge-based information is stored. All the specifications and examples are built in JSON. JSON stands for JavaScript Object Notation and is a very common format for machines to parse and use to pass data between one another. It's very fast, it's very efficient, and it's a very clean method of storing data. And another way of saying machine readable file is also saying API. So API stands for Application Programming Interface. In computer science, and when you're talking about software development, typically the term machine readable file is less common and less used as an API response or an API payload or other API terminology similar to that. So either way, we have a large data set, machine readable file, and it has to be in one of these three data types: JSON, XML, or YAML. And again, this is for transparency and coverage. This is for the payers, not necessarily for the hospitals at this point. CMS has also created a validator, which is very interesting. There's nothing like this that exists for hospitals for their price transparency files, which is also surprising. But again, I think this is the direction that we're headed in regard for all machine readable files that CMS requires. So I would expect to see one of these for hospitals in the future. But that CMS TIC, Transparency and Coverage Validator, essentially takes a transparency and coverage machine readable file, ingests the data set, and ensures that it's formatted correctly and is, in fact, does meet the standards for compliance. The problem and the misunderstanding with a lot of these machine readable files for people that don't have a technical background is that they're really difficult to look at or to read or parse with the eye. And again, these are not necessarily meant to be looked at. They can be, and there are different types of softwares out there. If you were to do a Google search for JSON reader or XML reader, there are many programs out there. You can find browser extensions, you can find standalone software programs that will allow you to take these files and view them in a way that's much more easy to look at. But really, they're meant to be parsed by a machine and manipulated by a computer, not necessarily a person. So there are tools out there that you can download to get a better understanding of what's in the file. I did mention GitHub when I started here on this slide. GitHub is a source code repository typically used by engineering teams to host software and make changes to software in a collaborative way. Again, CMS has focused on aggregating all the information for transparency and coverage and investing into GitHub, and all of this documentation about the requirements and the specifications for these files. It's all available publicly. If anyone would like to receive a link to that, I'd be happy to provide one over email. Otherwise, you can just do a quick search for transparency and coverage and GitHub on Google, and you should be able to find it pretty easily. There's lots of very valuable information there. So part of the price transparency requirement for both hospitals and the payers is the component of the payer negotiated rate information. This rate information needs to be posted in the machine readable file for every item in service. And the machine readable files, of course, look different. They're structured differently for hospitals and payers because we're dealing with different organization types, and the end result is slightly different. But in concept, it's very similar. This is all outlined in that CMS price transparency guide that I had mentioned in regard to how to access that data from the transparency and coverage files. So if you were to go out and fetch the publicly available transparency and coverage machine readable files for United or Blue Cross or Cigna and download those and open them in a reader, you should be able to follow the guidelines in the CMS price transparency guide, which is in GitHub, and find those data points and be able to see those rates for the individual items and services, and also search for your facility by TIN or EIN. The idea here is that you should be able to extract these data points. There are many programs that allow you to do this with JSON parsers, XML parsers, like I had mentioned. This data holds, these files hold a wealth of information for your facility. You know, the traditional way of looking at your negotiated rates is looking at contracts, looking at old PDF files. We do this all the time. We visually extract data from payer contracts, commercial payer contracts for our clients. We have many methods of doing this, but that's one of them. And you know, you can pull the data from your contract. You can look at X12 EDI files, which is an encrypted electronic remittance advice file, which allows you to view all sorts of information about your claims, including your negotiated rates. However, this new rule for payers allows you to get a very specific and accurate representation of their understanding of your negotiated rates for every item and service at a very granular level. And you should be reviewing that, and you should be storing it and ensuring that it aligns with your contracts, it aligns with your claims, and making sure that there aren't any discrepancies there. So just a little bit on the No Surprises Act. So we've got two rules so far. We've got hospital price transparency that we've discussed. We've got payer price transparency that we've discussed, which is the transparency and coverage rule. We've also got the new rule for hospitals, which is the No Surprises Act, which requires hospitals to provide patients with good faith estimates. These three rules, in my mind, are very tied together, and they all are interrelated. And it becomes very clear when looking at technical specifications from CMS and those requirements that these are all meant to work together. And if used correctly, if the data is used correctly in these machine readable files, you should be able to have a very streamlined and robust system that is very accurate across the entire platform. So your price transparency is aligned with your good faith estimate delivery. All of your payer contracts are aligned with what the payers are posting, what you're posting in your machine readable file. They're all tied together. When it comes to the good faith estimate, hospitals are now required to provide patients with a good faith estimate at the time of service. And that good faith estimate must be in a very specific format defined by CMS, and it needs to be provided to patients at any place in the hospital where patient financial transactions could occur. So I won't go too far into the No Surprises Act, but there are many requirements here that hospitals are now required to follow that can be enhanced and streamlined with these transparency and coverage files if collected and parsed correctly. So enforcement. Let's talk about enforcement for hospital price transparency first, because it's historically that's been an interesting to watch as it unfolds. So when price transparency was first in effect, January 1st of 2021, we saw a lapse in enforcement. That is steadily been increasing, and we've seen CMS go to the state level for enforcement. Here in Texas, where ClaraPrice is based in Austin, Texas, we have Texas Health and Human Services, which has more strict price transparency requirements for the hospitals, and they have pretty extreme enforcement measures in terms of providing corrective action plans if you're out of compliance, making sure that every piece of your compliance is addressed. You have a very minimal time period to perform your corrective actions and turn that around and to become compliant. But I think that the point here is that we're going to see more and more of that on the price transparency side for hospitals. We're also going to see enforcement for transparency and coverage for the payers. It's only going to be increasing. This is evidence-based. We've seen CMS just recently awarded a contract for price transparency enforcement to an organization, and it's a 5-year contract, $13 million. We're going to see that organization assisting with compliance enforcement, and we'll see a major increase in enforcement communications, both at the federal and state level. We also saw an FGA enforcement lawsuit specifically for the Biden administration for not enforcing No Surprises Act. So it's just more evidence that actions are going to be taken by the federal government to ensure that enforcement increases and stays on track with what they've promised and said that it would be. So it's all increasing. So the most important part here, and really the main concept of this presentation, is that you should be using this new transparency and coverage data to power all of your other components of compliance. That's going to be your hospital price transparency, your good faith estimates as part of the No Surprises Act. All these things tie together, and having a really good understanding of your payer contract information is really the first step. So, finding those PDF contracts, making sure you understand what's in them, making sure that you have the most recent version. We see contracts all the time from, 20 to 30 years ago, and facilities don't necessarily know if those rates are still even valid. So having a really good understanding of what your contracts say, and then also, using this new public information that's contained in the transparency and coverage data files. These are the most modern and standardized and structured sets of data that we've ever seen. It's really a shift in the healthcare industry, and there's tons of valuable information in these files that you should be using for your facility. And you can be using this for your price transparency, compliance, making sure that what you're posting is accurate in comparison to what the payer is saying that your rates are. If there's a discrepancy there in the future, that's going to be found through validation software that CMS creates. So having a good understanding of, of what those rates are and making sure that they are consistent across mediums is going to be important. And also using that information, that rate information and service level information to power the information that's provided in the good faith estimate that's then delivered to the patient, making sure that everything is consistent across all those resources where you don't have discrepancies and you open yourself up to liability or legal issues with patients. So this can be done with your own internal IT team, people that understand computer software, people that understand application programming interfaces, APIs, machine readable files. Taking a look at the documentation in the CMS repository, it's pretty easy to figure out from a technical perspective what you can do with the files, where you can find them, and how you can parse them if you have a technical background. And the alternative is to find an expert to work with. There are many subject matter experts in this area, and finding a compliance partner that can walk you through it and make sure that you understand all the different components for each of the mandates is also a great option, and probably one of the better approaches. So with that, I'll wrap it up here and pass it back to Mike. But before I do that, I just want to say thanks everyone for the time. Again, I'm with an organization from Austin, Texas called ClaraPrice. We are an NHA Services Preferred Business Partner, and we focus on price transparency compliance and No Surprises Act compliance with good faith estimates, and wrapping all that together and making it all work together the way that it should, utilizing CMS modern data and modern technologies. So again, I really appreciate your time. We'd really like to earn your trust in this space as a preferred business partner, and our team would absolutely welcome the opportunity to serve as an extension of your team in the future. So please let me know if you have any questions. You can always shoot me an email, jory@claraprice.com. Again, back to you, Mike. Really appreciate the time.
You bet. Thank you, Jory. I know there is a lot to unpack in this space, and we appreciate you being the subject matter expert here, especially with the ever-evolving healthcare landscape. At this time, we'd like to open it up for question and answer. Please don't be shy. Again, if you'd like to send me a private message, you're certainly welcome to do so. But now is the moment that we can all learn together. So with that, if anyone would like to unmute and ask a question, this is your moment.
Jory here. I also did want to add that we do complimentary assessments, compliance assessments for your price transparency. So if you have questions about your price transparency that you might not remember or think of now, think of later, uh, please don't hesitate to send me an email. We do assessments on a weekly basis to dig into this subject matter. So just know that we're out here as a resource.
Jory, I have one. I hope I can package this together with the individual that sent that, but we'll remain anonymous here. But essentially, can you talk about what would happen if one of our member hospitals received a letter from CMS or a state agency indicating that they're out of compliance and they're being asked to take a corrective action plan? Essentially, can you talk about what that looks like?
Sure. Yep. We've dealt with this a lot in the state of Texas. Many hospitals have come to us for help with their compliance. Again, I mentioned this in the during the presentation, but Texas Health and Human Services has been very strict in regard to ensuring that all Texas hospitals are in compliance. And so, speaking from that experience, typically what we see from CMS and the state level agencies is there's a request for um, corrective action. So if they deem you as out of compliance, you'll receive an email, or either email or mail, sometimes both. And in that notification, there will be a description of delinquency and a request for your corrective action. That corrective action must be an explanation as to what your corrective action plan will be, how you're course correcting, how you are taking corrective action to achieve compliance, whether that's, I've found a subject matter expert or I've contracted with this organization to help me with this. I've not been able to do it. I don't understand how. Or, we've reprioritized internally. Our IT team is now focusing on ensuring that we are in compliance by X date. Providing an explicit and detailed response with a timeline in that counter response to CMS or your state level agency is going to be really important based on what we've seen. But that's what you would expect, and that's kind of what the recommended action would be.
Great. Now, it looks like we just had a question come in from Taylor G. It was said to use the payer TIC data to compare with the facility. Where is that found from each payer's, I believe, website?
Sure. So those are typically found from the payer website. So you'd have to typically do some searching. There's not an explicit requirement for where it gets posted. On the hospital side of things, it needs to be within just a couple clicks of the homepage. On the payer side, it's not as explicit. It's not as exact. But you should be able to find those files from the payer website. For example, if you were to go to United website, there may be a transparency and coverage or machine readable files link somewhere. I'd be happy if you're looking for a specific file or for a specific payer, I'd be happy to provide some guidance over email. But without having it in front of me, I can't really say exactly. But again, you can find those specifications in the CMS GitHub repository, the price transparency guidance repository, which if you do a Google search or if you'd like me to send out that link, I can do that as well. That will allow you to find those files, pull them down. And once you have those files pulled down, they're typically going to be in that JSON format. I've only seen a few in XML. I've not seen any in the allowed YAML file. But again, JSON file typically, and you're going to need a reader. There are many JSON readers out there. So if you just did a quick Google search for JSON reader program, you should be able to find one to download and open that file. At that point, you kind of have to know how to search the file to find the data that you're looking for. It's nested in a way that takes some subject matter expertise to dig into it. But by reading the documentation in the CMS Transparency Guide repository, downloading that reader, you should be well on your way. And again, I'd be happy to help anyone with that in real time if needed.
Awesome. Jory, I have a personal, more of a curiosity question. I hope I don't butcher this, but in former careers, I used to live and breathe out of Excel, and it seems like Excel is so well known across many industries. And from what I understand, Excel is not permittable by CMS in machine readable format. Why not?
Correct. Yep. So Excel is not allowed for the payer price transparency files. It was, in my opinion, mistakenly allowed on the hospital side. Hospitals now can post their machine readable files in Excel or CSV for that matter. I think they realized the mistake in that decision with the transparency and coverage requirements and do not allow Excel. So that is correct. And the reason for that is that Excel is it's a tabular data format. You've got an x-axis and a y-axis, and you can really store data in those rows and columns, and that's pretty much it. When dealing with large data sets like this, we have data that is related in a nested format. So you might have, for example, negotiated rates that are related to specific hospitals, that are related to specific departments, that are related to specific sets of services. And each of those services have different modifiers with different rates. So when you start thinking about it that way, it becomes really difficult to store that data in a program like Excel with such a simple data structure. You need the ability to store that data in a nested fashion with a parent-child relationship, if that makes sense. And JSON and XML specifically are great data standards for which you could store that data. Excel is not. Also, it's a misnomer because Excel actually isn't machine readable. It's not readable by many software programs. A CSV file would be, because it's a delimited text file, but Excel really is not a machine readable file. And again, I think that we'll see those requirements change as the hospital price transparency requirements continue to evolve.
Sure, that's interesting. Thanks for unpacking all that. That was
Sure.
more than just a singular answer. Wow.
I know it's kind of a cognitive load. All of this is really a cognitive load. There's just so much here with all these compliance requirements and how they interrelate, and the complexity of the data elements and all the different tools that you need to parse and view. It's a lot. So happy to be a compliance resource to anyone that has more specific questions.
Absolutely. Anyone else? All questions welcome. Also, key takeaways from the day, we'll welcome those as well. If you learned something new that you'll be able to utilize at your hospital or organization. We'll give it just another 20 seconds here, Jory. All right, I'm not seeing any other questions. So, Jory, we would like to thank you on behalf from NHA. This topic will continue to change, continue to evolve, and we're certainly glad to have you as a trusted partner. For those of you that will be joining us at the NHA Annual Convention, October 19th through the 21st, please stop by and see us at NHA Services, as well as please come see Jory. With any additional questions in this topic specifically, we will certainly be there live. So with that, let's go ahead and conclude. Jory did volunteer to send the PowerPoint out for additional information. We'll go ahead and do that to everyone who registered. And then this meeting was recorded, so we will go ahead and publish this to the Nebraska Hospital Association's YouTube channel. I would say in the next week. That way it'll be available to all of our members. Jory, thank you again. Let's go ahead and conclude. Everybody have a wonderful Wednesday. Thank you so much.
Thanks for having me, Mike. Appreciate the time, everyone.